therapy or group setting.
Sabrina, floor is yours.
Thanks, Dr. Shafi. So I'm just going to share my screen here.
Please.
Okay, can everyone see this?
Yes.
Okay. All right, so good evening. My name is Dr. Sabrina Diaram. I'm a proud ITMD. So today we're going to be talking about mental health and diabetes. So this is essentially a little bit more information from the previous presentation. So feel free to ask me any questions afterwards. Okay, so Dr. Shafi asked me to add this slide. So I did have it in my previous presentation. I took it myself, so this is actually Sandy Ground Village in Anguilla, just to kind of give you a little perspective as to where the country is, where I went to medical school. And this is also just another picture from their most popular resorts, Viceroy. So let's get right into this. So this is our discussion topics for today. We'll go through some definitions, just the Diabetes Canada position statement, as well as the background and rationale, actually all the mental issues that come about, as well as the assessment methods, the interplay, how CBT helps, how we monitor metabolic risks, as well as some final recommendations. So there's often a negative effect on many aspects of diabetes management and glycemic control, essentially due to the psychological issues related to their self-care demands and the diagnosis. So I thought it'd be important to really clearly define some terms. So psychiatric disorders are mental illnesses which may include conditions such as major depressive disorder, general anxiety disorder, and any eating disorders. And unmanaged psychological distress may trigger or actually worsen existing psychiatric conditions. So psychological distress is a term that includes a range of negative feelings and emotions that people can experience in reaction to adversity. So ongoing or persistent negative moods such as sadness, frustration, and anxiety can be mild or severe and may actually affect their quality of life. So this is Diabetes Canada position statement. So they believe that individuals with diabetes should be regularly screened by their healthcare team for psychiatric disorders and psychological distress. So access to mental health professionals and community support should be timely, affordable, and ongoing. Diabetes self-management education should incorporate strategies to prevent and or manage their psychological distress related to the diagnosis and their management. So this is their background and rationale. So diabetics are often overwhelmed or frustrated by the burdensome demands of managing their chronic disease. So they can feel angry, guilty, frightened, discouraged, depressed, and unmotivated, and they might have strained relationships. People with diabetes are at greater risk of mental illness, and then people with some mental illnesses are at greater risk of diabetes. So they actually go hand in hand. And depression is more common in people with diabetes compared to the general population. And major depression is present in approximately 15% of people with diabetes. So their self-management education and follow-up is extremely vital to understand in managing diabetes. It can help to reduce their psychological stress. However, there's long wait lists and at diabetic clinics and poor access in rural areas, and sometimes those are seen as barriers to accessing the required education and ongoing support. So the depression associated with poor self-care and poor blood glucose control, some health complications, decreased quality of life and psychological well-being, as well as increased family problems and higher healthcare costs. So it's very crucial that physicians and other members of the diabetes healthcare team consider and address all psychological aspects of living with diabetes. So we'll just get a little bit more into the diabetic mental health. So mental health disorders can affect diabetics' ability to cope and care for themselves. So it's just as important to look after one's mental health as it is to ensure optimal physical health. So here are some common feelings that they might be experiencing: shock and denial. They might feel numb, overwhelmed, confused. It's common for them to, think that the diagnosis is wrong and not manage the disease at all. So it is actually very necessary to accept and recognize the importance of the condition. They could experience anxiety, so this excessive, unrealistic worry about the circumstance, usually without an identifiable cause, but it could obviously be associated with their new diagnosis. They could also just be afraid of the unknowns with diabetes, and of course there are complications that are associated with the disease. So it's very important to recognize their signs and symptoms, and that mnemonic for Andy Crest kind of goes through what they could be presenting with. So the two main treatments for the anxiety disorders are medication, so any anti-anxiety drugs or antidepressants, and psychotherapy, either alone or in combination. So they could also feel anger, you know, thinking that this is very unfair, that they have to be dealing with diabetes for the rest of their life, resentment of the healthy behavior changes that are important and part of the management. And it could also be a consequence of low blood sugar levels as well. They could experience grief, which is really common, and they could feel like, you know, their life has changed forever, and they mourn the loss of the lifestyle that they had before the diagnosis. Depression, so when the grieving period results in a prolonged sadness, that's a sign of depression. So it's twice as common in people with diabetes as compared to the general population. And again, it's associated with poorer control. So the depression may develop because of stress and anxiety related to the managing, and it also often goes undiagnosed and untreated. So these are, again, things that we need to watch out for if there's any changes with their sleep, if they're losing interest, if they feel guilty, if they have a low mood. These are definitely things that you need to take into importance. So it's treated with medications, antidepressants, CBT, or both. So this is the Canada Diabetes Assessment Method. So there's diabetes distress scale, and that's something that they would do to assess if the patient is dealing with just distress, which is a self-report, and they use ratings based on their feelings, or they could use the PHQ-9 questionnaire to rule out major depressive disorders. And this chart I thought was very important. It's just showing that there's a huge reciprocal susceptibility between both major depressive disorder and diabetes. And there's also high comorbidity with general anxiety disorders. So all in the white squares, you can see all the types of, you know, personality disorders, any kind of stress or trauma, eating disorders, bipolar, schizophrenia, and how they're all interplay and linked to major depressive disorders as well as diabetes. So this is just some features of how cognitive behavioral therapy can be applied. So just the cognitive and behavioral components are found to be the most promising when it comes to treating their mental health issues as a diabetic. And it's actually more ideal to start with this versus just treating with antidepressants. So metabolic syndrome is actually found at higher rates in individuals with psychiatric illnesses than in the general population. And then patients with diabetes and comorbid psychiatric illnesses are at elevated risks for developing the syndrome. It could possibly be due to the patient and how they're managing it, the illness itself, the medications they're taking, and environmental factors. Because of the risk of their adverse metabolic effects of many of the antipsychotic medications that they could be on, the Diabetes Canada recommends regular metabolic monitoring, and it should be performed in people with and without diabetes who are treated with this medication. So these are just some parameters showing what they're checking at baseline and how frequently they check this. So what should we be advising diabetics? So definitely collaborative care with interprofessional teams should be provided for the individuals with diabetes and depression. So their goal is to improve their symptoms, make sure that they're adhering to their medication, both the antidepressant and any insulin or non-insulin anti-hyperglycemic medications, and making sure that they know how to check their sugar as well as maintaining glycemic control. Psychosocial intervention should be integrated into their care plans. The antidepressant medication should be used to treat the acute depression. as well as for maintenance to prevent recurrence of depression. And like I said before, the CBT can be used to treat depression in individuals with depression alone or in combination with the medication. And of course, the regular metabolic monitoring. And then specifically in children and adolescents with diabetes, they should be screened at their diagnosis for MDD and regularly for any kind of psychosocial difficulties or family distress or mental health disorder. And individual and family educational intervention should be included to address any stress or any diabetes-related conflict when it's indicated, as well as in adolescents with type 1 diabetes should be regularly screened, and using non-judgmental questions is very important. Thank you so much. Any questions?